Yes.
According to Jay Barty's article, The Gross Science of a Cough and a Sneeze, scientists measured the average human cough and determined that it shoots air out of the lungs, forcing approximately 3,000 droplets out of the mouth at speeds up to 50 miles an hour. But what's worse is a sneeze. A sneeze can produce about 40,000 droplets and shoots out the droplets at speeds exceeding 200 miles an hour. This is pretty important. This is my guy here, and this is just an example of him coughing and all the droplets coming out of his mouth. It's kind of small. Droplets vary in size and weight. The smaller the droplets are, the more likely they are to fly around the air and for other people to inhale them. Just imagine if those droplets were infected by the influenza virus. Just imagine how fast that influenza virus was spread just by an uncovered cough or sneeze. Influenza affects millions of people around the world each year, and approximately 1 million people die from this virus. But there is a safe and effective protection out there. It is the flu vaccine. The World Health Organization recommends that children 6 months of age and older, pregnant women, people with comorbidities or other diseases, and the elderly should get the seasonal flu vaccine. But why should the protection stop here? The International Nursing Review expresses the need for flu vaccination for all healthcare workers in an article titled "Protecting Patients, Protecting Healthcare Workers, a Review of the Role of the Influenza Vaccination," written in December 2011. The article states, "Seasonal influenza is a major threat to the public health, causing up to 1 million deaths worldwide annually. The review expresses that it is imperative that the healthcare workers be vaccinated, not only for their protection, but for their patient protection as well, because this reduces the chance of hospital-acquired infections. Although healthcare workers and special populations would benefit the most from the flu vaccine, Fiore, Bridges, and Cox go on to say that the flu vaccine would reduce the health burden and benefit everyone in their article titled "Seasonal Influenza Vaccines," which was published in the Current Topics of Microbiology and Immunology. There is a safe and effective influenza vaccine available. The CDC's statistics on the flu vaccination coverage from 2009 to 2012 have been steadily increasing in children. This is the ages 6 months through 17 years. And just over 43% of children obtained from a large sample size were vaccinated in 2009, and just over 56% of children obtained from the same sample were vaccinated in 2012. This shows a 13% increase in the 3 years of that time period. Adults are a different story, however. The percentage of adults had only risen 1% from 2009 to 2012, which begs the question, why are adults not getting this vaccination? Well, the CDC website discusses many reasons, and the number one reason is reluctance due to safety concerns. Also, healthy people, they sometimes think, well, I'm healthy, why should I get the vaccine? It's not going to do me any good. And the third reason is the cost. But there are programs out there which could help you pay for this vaccination, and that's Medicaid or through other resources. The influenza vaccine has minimal side effects, and the severe side effects are rare, and all side effects are available to the public. Mazzoli et al. Found that the flu vaccine they had studied, some recipients developed minor localized infections. Some localized infections, explains the CDC, include pain, soreness, redness, and swelling at the injection site. Mazzoli et al. Also went on to explain that Guillain-Barré syndrome wasn't of concern in their study. It is important to understand that GBS, or Guillain-Barré syndrome, which can cause paralysis and respiratory failure, is a very rare syndrome, and that there was an increased incidence in those people who got the 1976 swine flu vaccination. In recent studies, the CDC states that anyone can get this syndrome, but it has an increased incidence in those people who are 50 years and older, no matter if they were vaccinated with the flu vaccine or not. The CDC and the World Health Organization are obligated to have all information about vaccines, including side effects, readily available to the public, and people could visit cdc.gov and who.int for the World Health Organization information, if you guys have any questions about that. The seasonal flu vaccine contains 3 or 4 strains of viruses. Depending on which strains are predicted to be the most prevalent in your area, the flu vaccine can be given inactivated or activated, and by nasal spray or injection. Both are equally effective, but infants and pregnant females are not allowed to get the activated virus vaccines. In the early stages of the vaccine, the H1N1 virus was tested in mice, much like any other vaccine trials. In a study done by Koch et al. In 2010, they found that the previous strains of the H1N1 virus that infected mice proved to be effective against the new strains of H1N1 virus. This is monumental because researchers can hypothesize and investigate that since mice are showing some immunity to the new strains of the virus, then it is quite possible for humans to show some type of immunity to different strains of the H1N1 virus as well, which can lead to better protection in years to come from difficult, ever-changing, harmful viruses. Getting the flu vaccine this year is the obvious choice because it is safe, effective, and there are programs out there to help you pay for it. Choosing not to get vaccinated because you are ill-informed or are scared of the side effects is outright negligent on your behalf because this virus spreads rapidly and it can kill. If you are ill-informed or have more questions or concerns about getting the flu vaccine this year, you need to do some research and get informed quickly. You will discover that the flu vaccination is the best preventable measure you and your family could take this year against influenza. The flu vaccination is our only protection against the flu virus. The flu vaccine is safe and has been proven effective in numerous studies, not only for special populations, but for healthy adults as well. The flu season is currently underway, and cases of the flu are beginning to show up around the country. But it is not too late to get the flu vaccine. Remember, you are only one uncovered cough or sneeze away from being infected by influenza. So get vaccinated. And that's it.